Good afternoon. I'm Adrian Dix, BC Minister of Health. I'm honored to be here on the territory of the Lekwungen-speaking people of the Songhees and Esquimalt First Nations. To my right is Isabelle Mckenzie, BC Seniors Advocate. And I just want to give you a sense of what the media and the public can expect in terms of briefings over the next couple of days. At 3 o'clock, I will be briefing along with Dr. Bonnie Henry, and I will be briefing at 3 o'clock. And so questions relevant to the overall COVID-19 response and issues around that can be dealt with at that time. We're making a specific announcement today with respect to seniors in community. Tomorrow morning at 10:30, Dr. Henry and I will be here for a media briefing around issues around modeling. And there will be a pre-briefing for members of the media starting at 9 o'clock tomorrow morning. So that's what you can expect in the days to come. And as I say, questions relevant to questions related to the overall response for Dr. Henry or myself can wait till 3 o'clock today. Most seniors live at home. We know this. We've taken very strong measures and will continue to take strong measures to support seniors living in long-term care, seniors living in assisted living, but a very significant number of seniors live at home, and these are challenging times for seniors living at home. We have throughout BC, and we have a network of organizations and volunteers in community that support seniors in community living at home, and those networks as well have been stretched in recent times. So last week I convened a committee that has done extraordinary and rapid work to put together a response to assist seniors living in community and also to harness in the safest way possible the enormous desire of British Columbians to support their neighbors, their friends, their communities. I get contacted every day by people who want to help and who are engaged in helping, and that is an inspiring thing in difficult times. So last week I convened a group co-chaired by Isabelle Mckenzie, by Terry Collins, an outstanding public servant in the Ministry of Health, and involved 5 members of the legislature. Ronna Ray Leonard, who's the Parliamentary Secretary for Seniors, Shirley Bond, MLA from Prince George and former Deputy Premier, Janet Rutledge, an MLA from an NDP MLA, a government MLA from Burnaby, John Yap, an MLA from Richmond, and the Green Party House Leader, Sonia Furstenau, with the idea of developing together under the guidance of Isabelle Mckenzie, a program that would help seniors who are living at home, seniors in community. On Monday, as all of you know, in her update, her economic statement, Finance Minister Carol James announced there would be $50 million in new support for Better at Home programs for the United Way, whose Better at Home program engages 68 community organizations across BC, 24 of which are involved and will be involved in COVID response. And so this work that people came together and have done is extraordinary work, and Isabelle Mckenzie will be speaking to it in a minute, but it reflects, I think, the commitment of all people, and I want to thank all 5 of the MLAs, the team at the Ministry of Health, and in particular Isabelle, for their involvement, for the speed in which they've moved here to provide some additional supports to address issues of isolation that occur. Because as we all know, people often, especially seniors, need to stay home to stay safe. But they need support in doing that. We can't let social distancing become isolation. And that is part of what we're trying to achieve today. So with that, with the details of the program, and just to put it in context, the person who will be in charge, Isabelle Mckenzie, the other person in charge, Terry Collins, the board of directors will be the MLAs from all parties and from many regions of the province. Will be announcing our program and this program to assist seniors living in community. I'd like to welcome Isabelle.
Thank you very much, Minister Dix. I'm Isabelle Mckenzie, Seniors Advocate for the province of British Columbia. As you know, on March 8th, 2020, BC declared a public health emergency due to the COVID-19 outbreak. And I know that people across British Columbia are anxious and they're worried about their health, about the health of their loved ones, and about what the future holds. Seniors are especially worried about COVID-19. it is particularly serious for the elderly people and those with underlying health conditions. The Provincial Health Officer, Dr. Bonnie Henry, is asking all British Columbians to stay home, to self-isolate as much as possible, and when it is necessary to go out for essential activities, to stay at least 6 feet away from other people, and to not go out at all, even for necessities, if you are feeling at all unwell. These measures are vitally important as we try to protect our vulnerable seniors. As Dr. Henry reminds us, it's not just about you getting sick. It's about bringing the infection home to your family. And this could include your mom, your dad, your grandma, your grandpa. Most of us are following Dr. Henry's advice, and seniors want to do the right thing and want to stay at home, but they're going to need our help in order to do this. Within a matter of weeks, things have changed drastically for all of us. They continue to change as we implement more safety measures each day to protect all British Columbians. And it's clear COVID-19 will not be with us forever, but it will be with us for some time. If we put ourselves in the shoes of a senior, we can begin to understand the additional challenges older adults will face in responding to COVID-19. Seniors are most at risk of COVID-19 and the seriousness of this virus, and they are frankly afraid that if they get it, they will die. They are also more likely to have complicated health issues, more so than most of us, and they're worried about whether they'll receive the care for those health issues while we're focused on the battle with COVID-19. Many seniors rely on friends or family, neighbors, to visit them, shop for them, pick up their medications, make them some meals, and drive them to medical appointments. This support network that provides many of the essentials that allow seniors to continue to live independently in their own homes has been strained by the COVID-19 restrictions. And seniors are overwhelmingly more likely to live alone. And they are less likely to be plugged into the social networks of FaceTime, Skype, and Zoom. And that's why we are here today. As Minister Dix has spoken of, I've been working with the Ministry of Health, my colleague and co-chair Terry Collins, and an all-party legislative committee of MLAs on ideas of how we can better support seniors during this pandemic. While we know there are many seniors who are at added risk for COVID-19, we have also seen an amazing outpouring of community support as it becomes clear we're all concerned about the elderly in our communities. All over this province, every hour of every day, people are stepping up and reaching out to the seniors they know. They're offering to get their groceries. They're taking time to give them a call. They're dropping off some dinner. Many businesses are showing they too are concerned and are responding with dedicated shopping times and increased delivery capacity. To all of you, I say most profoundly, thank you, and keep on doing what you're doing. However, my office, as well as MLA offices throughout the province and other offices, are being flooded with calls of people who want to help seniors. We're also getting calls from seniors and worried family members outside the province and in different communities from where their mom and dad live about how they can cope and what help there might be. Connecting the people who want to help with the people who need help is going to be a key strategy in meeting the needs of seniors in the coming weeks. And together we have come up with a way to do this. The government has provided the necessary funds to expand BC 211. It's a 3-digit number, 211. You can now call it from anywhere in the province and you will reach a live operator. It's backed up by a website, BC 211. And they will manage calls from people who want to help as well as people who need help. So the message is simple. Wherever you live in BC, if you want to help seniors with virtual visits, picking up and delivering some groceries, picking up and delivering some medications, maybe dropping off a meal or two, call 211 or visit the website. And we'll try to match you up with a senior in your community who needs help. If you are a senior or the family member of a senior who needs help, getting groceries, getting their medications, staying connected, call 211 or visit the website. And we'll try to match you up with a volunteer or some kind of service in your community that will provide the help you need. In addition to the expansion of BC 211, the government has also increased funding to the Better at Home program significantly. And it's delivered by 68 different community agencies all across BC. They're getting additional funding to ensure that the core Better at Home services can meet the COVID-19 challenge. And 24 of these agencies have been designated as COVID response agencies. And they will be resourced to meet the new demand from the increased number of volunteer and client screening and matching processes that will happen. They will cover all of British Columbia. So after receiving a referral from BC 211, Better at Home will work to match seniors with volunteers and to support them through the COVID-19 crisis. Services available right now to seniors include meal delivery, help with cooking, delivery of groceries and medicines, wellness checks, calls, and visits. These supports will go a long way in helping seniors stay safe at home and to relieve the anxiety and worry that many seniors are feeling. My message to BC seniors is simple. Please do not be afraid, but please stay home and let us help. We want to help. Your kids, your grandkids, your community, every one of your elected officials at every level of government want you to be safe, and we are here to make sure that you're supported. Please, let us pick up your groceries. Please, let us get your medications. Please, let us give you a call each day. Please, let us know if there's something you need. Let us drop off dinner. If you're one of the tens of thousands of seniors who are normally the ones volunteering and helping, give 211 a call. You can help out with virtual visits, virtual calls. But please, now is not the time to be out and about in your community. You can help us all by letting us help you. It's not forever, it's for now. If you need help, call 211. If you can help, call 211. I would also ask that in showing our kindness to one another, we also show a little patience as we roll out this program. Significant capacity has been added, but this is uncharted territory. If you can use the website, please do so, and know that we are monitoring call volumes and will try to make necessary adjustments. We simply don't have the luxury of time that is necessary for perfection. And now I'll turn it back to Minister Dix, or I am open to any questions.